Depression is very common. A high percentage of us will be affected at some point in our lives. In fact, depression often first appears in adolescence, and the trouble with that is that it can be difficult to decipher between normal teenage angst and depression, which can make it hard to diagnose and also much harder to treat. But there's a new form of treatment on the horizon, which doesn't necessarily require medications.
One night I was sitting down at dinner with the family and a comment was made that under normal circumstances I would have laughed off, and I just remember slamming my fist on the table, feeling extremely angry and aggravated, and stormed out. I ran away to a park just around the corner, and for the first time everything just came up. For so long, now looking back, I had been suppressing so many dark emotions of anger and hatred and negative thoughts and sadness, and I had so much physical rage inside of me. It was such an anger that I had to let it out, and I would stood in front of the wall and I just let out, and I was punching the wall and punching and punching, and the wall started to go red. My fists were killing me, and as soon as it stopped, after I don't know how long a period of time, I just started crying.
A term that's often used by kids as well as their families is that they're feeling crushed by depression, crushed by this feeling that nothing will get better. And even though they've tried, for example, medications, they've tried going to therapists, they continue to struggle and struggle deeply.
There were days where I just wouldn't go to school. I couldn't go to school. I stopped playing sport with all my friends. I stopped going to the beach. Every time I got invited to a birthday or a party, I didn't go. I'd come up with any excuse not to go. I withdrew from everything.
Many of the kids that we end up seeing in the acute care setting struggle with depression that hasn't responded to antidepressants. And these are the kids who are attempting suicide. These are the kids who are falling out of schools and really losing a lot of their grip on the developmental track that they had been on.
Just waiting for the medication to build up in your system so it can be in there for it to work. And then when it didn't work, as none of the medications for me personally did work, then I had to wait for it to get out of my system before I found a new one. You feel hopeless because there's nothing else you can do. I tried everything, and these medications, it changed you. One killed all my emotion. There was one that made my suicidal ideations 100 times worse. There was one that made me gain 20 kilos in a month. And it's all just a trial and error. There's no one pill that fixes everything.
Do you know why some adolescents are treatment resistant?
That's a challenge. Sometimes we think it's related to the type of medicine they're using and whether their body will tolerate it. That's where pharmacogenomics come in, and we can actually look at the DNA associated with their body's metabolic profile and see if maybe they were never getting to adequate doses on certain medications. Sometimes it's the way their neurochemistry is configured. Sometimes it's the stress related to the environment they live in. There can be a whole host of challenges that are much outside of the here's your medicine, I hope you do better sort of relationship. Psychiatry has always battled crude techniques to try to handle the most desperate of situations. Back to lobotomies, which were in their own way horribly crude, and even electroconvulsive therapy, which is still used, where someone goes under anesthesia and then has an electric stimulus applied to the brain, and then they have a convulsion under anesthesia.
While ECT can be effective for some people, it's often seen as a treatment of last resort. Associate Professor Awol and his team have been working on a much easier alternative. It's called transcranial magnetic stimulation, and it doesn't require an anaesthetic, is much safer, and targets key areas of the brain from outside the skull.
The technology is a rapidly changing magnetic field that's provided by a coil that has electricity that will run through it. And through this electromagnetic field, you can turn it on and off quickly, and then you end up causing some nerve changes, some stimulus to occur.
So does it hurt? Can you feel it?
You can, and that's probably the main complaint we get from both kids as well as adults who are going through the trial. When that pulse is being delivered, the skin is a bit of an insulator, and as an insulator, it wants to resist that pulse going through, and that can cause the skin some irritation, almost the feeling of a sunburn. and a loud kind of tapping sensation. Some folks can't tolerate it. The studies that we've done thus far, we needed kids ages 13 to 18 who had failed at least 2 prior antidepressant trials and were continuing to have very significant levels of depression. And at that point, we would have them stay on their medication where they were still struggling, but then apply TMS to see if over a few weeks' time their depression improved. They have that over a period of 30 treatments. 5 of the 7 children ended up being much or very much improved compared to their baseline scores on a variety of depression measures.
And did it allow them to reduce their medications?
Some went off of medications following the TMS treatments. Some that had actually been struggling with significant levels of pain actually said, I'm no longer having headaches, I'm no longer having this fatigue and myalgia. And so that's another finding that we're trying to understand more about.
And how long did the effect last?
We had to follow them up, according to the FDA regulations, 6 months following their final treatment. And the 5 of 7 continued to do well. We'll be seeing a good, 60 to 70% of previous non-responders turn into responders.
And what harms are associated with the treatment?
The main things we worry about is changes in hearing threshold. Everyone wears earplugs. The other thing we worry about is causing pain, but we've actually seen kind of the opposite effect, where people that had chronic difficulties are actually finding that dissipating. The other thing you worry about is a seizure risk, but that's a very, very low risk based on the current safety parameters that we treat within. We need to find new ways to provide very localized pharmacology changes. And I think that's what TMS does. Hypothetically, instead of bathing your entire brain and body in this chemical that you're taking, you can go with a very focused stimulation to an important area in depression, theoretically, and then change the chemistry at that spot rather than trying to change the whole brain's chemistry. And I think that's where this technology really has an opportunity to help a lot of folks out in a meaningful way.
And I'm so glad I fought through it, because I get to be who I am today. And it's because I kept fighting. Simply getting out of bed and not thinking of suicide. Simply getting out of bed, going to the gym, being able to socialize, being able to laugh and actually feel joy. The pleasure of joy from coming from such a dark place that can